Hey everybody, Dr. George Foedisch here. Today we're going to talk about the lumbar spine, the low back as it's referred to. And we're going to start like this. There's 24 vertebrae from your head to your waist, and then we sit on two more. So there's 26 total. Your lumbar spine, your low back, traditionally is considered to be the 5 lumbar vertebrae of your spine. That's what this looks like. Number one, it's supposed to be a curve. There needs to be a curve there so it can act as a spring, so every time you take a step, it absorbs some of that force, and it assists the discs, and I'll show you that in a second. But that's in general kind of what you want to see. You want to see a curve in somebody's back. We see a lot of patients like this, a lot of patients like that, as a normal standing vertical position, and that's way not good. So we're going to blow this up for you, and then just teach you some of these parts. Again, these are the vertebral bodies. Its job is to be like a brick in a building. It's supposed to hold you up. It bears the weight of your body. And then between them is that disc space. That's the intervertebral disc. You hear about prolapsed discs, you hear about herniated discs, and that's the cushion. It's supposed to absorb the shock. So between the cushion and the curve, we're supposed to have a lot of ability to absorb forces that we come in contact with every day. The next thing I want to show you is the joints, which are back here. Just simply put, the joints are like the hinges on a door. So when you slide and glide and move around, that's where that happens. If they're not sliding and gliding, you can't move in a healthy way. And those three structures, the vertebral bodies, the discs, and the joints, create this window, cave, or a hole. It's called the foramen, and that's where the nerve roots come out of. Your brain sends down the spinal cord, that's what that is, and at every vertebral level, every 24 plus, there's a nerve root that pops out of there. And if you understand the general physiology or general anatomy, you can start to understand how to take care of your back more successfully. Another concept that I wanted to share with you that I try to get every patient to understand is that your spine just is an static spine. It's not just a piece of scaffolding. So I introduce this idea of a cocoon. So our bodies are profoundly brilliant, and one of the things that our bodies do is it creates this cocoon around your spine. So your spine is embedded in this cocoon of muscles, ligaments, tendons, fascia, and it has to be flexible also for your spine to be more mechanically and neurologically sound. So we want to take care of it, right? So we only get one. So that's a general overall, pretty quick initiation into what your lumbar spine looks like and some of the parts and what the jobs of those parts are. So this is low back, lumbar spine month. So take care of it. You only get one. They haven't figured out a way to replace that thing yet. So take care of it, and we'll talk to you soon.